Surgical procedures are highly complex and often performed under immense pressure, which can lead to critical errors. Such mistakes can have severe, sometimes fatal, consequences for patients. Surgical errors represent a significant portion of medical malpractice claims, leading to numerous complications each year. Here is a graph of medical error risk across different surgical specialties. The data shows that surgical errors are alarmingly common in several specialties, with orthopedic leading in the number of claims. These mistakes not only increase the risk of complications, but also highlight the critical need for more effective training and preventive measures in surgery. How can we solve this problem? The solution is VR training.
So now let's look at how VR can solve this issue. VR, virtual reality, allows the user to immerse themselves in a digital simulated environment. This is done with the help of headsets and controllers that have haptic feedbacks. As can be seen here, this is a simulated environment where the user is on a very high rise building and is navigating with the help of controllers and gyroscopic sensors in the headset. Although this seems like a fun application as a game, but this is a very usable tool in providing trainee surgeons with a holistically better and interactive experience. This provides them an opportunity to go beyond regular textbook based learnings and gives a chance to them to fail, make mistakes, and learn from it, which is usually not available to trainee surgeons while practicing surgeries.
Now let's talk about how virtual surgery planning can help improve the time and efficiency of jaw reconstruction. This diagram shows the typical steps of virtual surgical planning, and I will quickly outline the most important steps. In data acquisition, an MRI scan of the patient is taken, and this is how we obtain the 3D model. In model visualization, the scan is then transferred to the computer. Surgery planning is the most crucial part, and this is where an engineer assists a doctor who wears a VR headset that is connected to a somewhat powerful PC. Here the doctor can see all the details of the patient's state and are able to output a patient-specific tool design. A usability study was conducted by the Royal Australasian College of Surgeons, where a diverse range of doctors learned to use the VR headset to plan a mandible reconstruction. The feedback was very positive as participants expressed that it was very easy to pick up, as well as they were all impressed by all the details that you can see in the 3D model. This video is a demonstration of what the surgeon is able to see inside their VR headset. The surgeon can see the magnified version of the patient and are able to immerse himself in this experience. Surgical tools, as you see here, are also able to be virtualized, so that the doctor has already rehearsed the surgery beforehand, making them more comfortable and more confident in the actual surgery.
Now, let's look at the application of virtual reality in surgeries related to the knees. Knee surgeries are one of the most common surgeries that take place, and they contain multiple inner muscles, ligaments, and tendons, making it very hard to replicate it physically and for surgeons to learn about them while doing textbook based learnings and physical demonstrations or cadavers when they're trying to learn from it. Hence, VR is used in this scenario. As you can see here, with the help of a VR headset, the trainee surgeon enters the surgery room. With the help of controllers, the trainee mimics surgical equipments and tools and gets haptic feedback when interacting with the virtually simulated model. Now, let's look at the application of virtual reality in the training for surgeries related to elbows and shoulders.
Before the rise of virtual reality, training for shoulder and elbow surgery was a significant challenge. Resident physicians had to rely on cadaveric models and saw bones to simulate surgical procedures, but this method had limitations. These traditional models couldn't fully replicate the unpredictability of real surgeries. like bleeding or unexpected complications, leaving residents without the invaluable hands-on experience needed for success. Then came virtual reality, revolutionizing how we approach surgical training. With virtual reality, resident physicians can immerse themselves in lifelike simulations, practicing complex procedures in a safe, controlled environment. For elective shoulder arthroplasty, precision is crucial. Just a 4 mm error in implant placement can lead to a failure. With 3D CT imaging, an advanced branch of virtual technology, surgeons can customize implants and visualize the procedure in unprecedented detail. Immersive virtual reality technology gives junior residents the freedom to practice without the fear of harming real patients. They can train anytime, anywhere without the pressure of being watched by supervisors, making the learning process more effective. Though still evolving, virtual reality is transforming surgical training as the technology advances. It's only a matter of time before it becomes an indispensable tool in medical education.
Whilst we do see how much support VR provides in orthopedic surgery, there are still a lot of limitations that we should address. The first one is that it is quite costly. We need to pay the engineers to set up and teach us the system, pay and train the surgeons on how to use the system, pay for the VR headsets, pay for the PC that the simulation runs on, as well as pay for all the scans we might take. Overall, it is very costly and may be out of budget for smaller hospitals. Another issue we have is usability. There is a steep learning curve to using VR, as well as VR handsets do not give any haptic feedback. The last one we have is accuracy. While simulations are very useful, they are very reliant on the original scan. If the scan is inaccurate, the simulation would be a waste of time and resources.
As we just saw the various limitations of using virtual reality in surgical training, now let's see what could the future offer to us. When Apple recently launched its Vision Pro, a mixture of virtual reality and augmented reality called extended reality, it changed the entire landscape of virtual systems and interfaces. When we got a chance to try it out, we were completely blown away by the seamless and lag free interaction experience we got. With no need for external controllers and other equipment to navigate around the user interface, we couldn't just stop but imagine ourselves in a future where such powerful devices are used for complex training of surgical practices.